All right, we're live. Oh
Yeah.
my gosh, we made it work. Hi everyone. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. Thank you for joining and thank you for hanging out with us. We had a little bit of technical difficulties, but we didn't give up. We are here. And I am honored and delighted to have on as our guest Dr. Loretta Duggan. How are you?
Hi, I'm doing awesome. Thank you so much for having me.
Oh, my pleasure. And Sam, thank you for agreeing to do this. Now, for those who are wondering, can you kindly introduce yourself? Who are you? What do you do? And we'll go from there.
Awesome. Sure will. Again, thank you so much for having me. For those who don't know me, my name is Dr. Loretta Duggan. I am a primary care physician trained in both family medicine and adolescent medicine, and I'm currently located in Athens, Georgia. So that's a little bit about me, you all.
All right, awesome. And Doc, why do you do what you do?
Yes, so I always knew that primary care would be my major focus. With the passing of my grandmother, that became my passion, right? So it was always preventative care. The shocker, though, was kind of more so adolescent medicine because I realized I had my own lived experiences too, for us dealing with heavy and painful periods. And
Okay.
hormones were such a godsend for me. So I had to tell everybody, I had to share with everybody. But then also building rapport with those teens, I felt like it went such a long way. And then it also took preventative medicine to a whole nother level because now we're meeting teens much earlier in life to hopefully help prevent these other outcomes that we hear about now and other unhealthy behaviors, right? So we're starting much earlier, building that rapport and communicating with them. And I'm learning from them too. So it's always a fun group to be with. So I'm glad I learned about the subspecialty of adolescent medicine.
Wow. I like that you say they're a fun group. Sometimes they look challenging because they talk back and stuff.
Well, you know.
We were once there though, right? All right. So for those who are watching hashtag live, those who are watching replay, hashtag replay, our topic is from meh to motivated, tips to motivating unmotivated teens.
Yes.
So we're going to start right away. And my first question to you is this: how can parents and caregivers differentiate between normal teenage behavior and when there's really a genuine lack of motivation and like red flags? What would you say,
Right.
Doc?
Yeah. So there may be times where a teen may become a little bit more socially withdrawn, right? They may
Okay.
become more isolated. But is it from maybe one category kind of in their sphere, or is it from everything? So, what I mean by that is not that maybe they're not talking to mom today. They may not be talking to their close friends. They may not be interacting with their coaches, or they're seeming to lose motivation in almost all things that used to interest them. So, that may definitely be more of a bigger red flag that there's
Okay.
something else going on. And then also just thinking about, okay, the negative attitude. So yeah, we think, okay, yeah, they're moody, they have the
Yep.
attitude. But is this something that's lasting over an extended period of time? So it's not just maybe a couple days, say they had a breakup or they had an argument with a friend, but this is lasting now weeks or we're getting into months. So we want to think about more issues that may be going on underlying, or even maybe mental health challenges, bullying, anything like that, when it's starting to prolong over a longer period of time, for sure.
Okay. Okay. So the length and also it's all around, not just snappy to one
Right,
person,
not
but
just one thing in isolation, but now it's their entire kind of sphere of influence
okay.
where we're starting to see that isolation and withdrawal.
Okay. What would you say is one of the most common or common factors that lead to teenagers feeling apathy or lack of motivation? Are there certain things that are unique to their age group, you think?
Mm-hmm. So a couple things kind of come to mind with that question. One is it that they're bored. So boredom can display itself in many different ways. there may be certain interests that they have that's not really relevant to something else they have to do. So let's say more about a creative, artsy type teenager. They may not be into the math and more concrete things. That may be boring to them. So they're going to appear to be unmotivated, but it's really that it's not as relevant to them per se.
Okay.
So that may be one reason. Another, if they feel that, okay, I tried to throw a little nugget out there, but I don't feel it was received positively, or I really feel unheard, then they may not offer that up again. It may be like, I may just keep it to myself because I'm not sure how it's going to be perceived or received by, say, the adult that I look up to or that I care about their opinion. So they may just be less likely to actually share and appear to be apathetic because of that. But it may be that initial response they received wasn't a positive one. And so now they're just withholding it more so.
Okay. So are there tips you have for maybe parents or mentors to kind of get, conversation going with teenagers that you notice are starting to like really lose motivation, not wanting to do things that typically they would do before, or they need to do because of what's ahead of them? Any tips?
Yeah. So one great tip is being cognizant of being aware of not just our verbal responses, but also our nonverbal actions as well. So we may speak or ask them, okay, tell me what's going on, tell me about your day. But non-verbally, if we as the adult, as the parent, as the mentor, are, say, scrolling on our phone, or we have a few other things going on in the background, they're not going to feel like I'm the main, point of interest here. I'm not the main focus of your attention right now. So that's one thing, being really aware of those cognizant cues that are nonverbal also. And then number two, rather listening to hear versus listening to respond, right?
Okay.
So we want to listen to actually hear and understand what they're telling us. And if we can give it back to them, then they'll know, okay, they're actually paying attention and they actually understand what I said, versus I'm listening because I want to make sure I respond, or I'm going to oppose what they say anyway because I already have my biases or perceptions about how I feel of what they're telling me. So kind of keeping that in check, so that way they know, okay, this is a supportive person that's here for me and that's actually going to listen to what I'm thinking and what I'm saying.
Okay. Listening to hear versus listening to respond. I think we could all use that differentiation. You're such an advocate for your folks. I love it. We're going to do this again. We'll see how questions, but we're going to do this again because I could see how you're going. Yeah. So I'm going to give this example. I had a patient who came to see me, and I asked, like, what's going on? He used to do the things, but now he doesn't feel like. And when I asked, he said, I'm afraid of the future. I'm afraid of failing. Like I was like, oh my gosh, like, wow, your future is so bright. There's still so much time. Blah, 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 blah. How do you get, what are tips for helping teens get out of that funk, or I don't think you ever get out of it completely, but how do you overcome the fear of failure and develop a like, let me try it. Like, how do you help with that, Doc? I don't know what to say.
Yeah. And it applies to us too, Dr. O, too. Failure is often perceived as a negative. It's perceived as a bad thing, a bad word per se, right?
Right.
But really, with anyone that has ever had any success, anyone that's ever succeeded, made progress, at some point, they likely had some type of failure. So it's not the failure itself, but is what's the lesson that we can learn? How can we grow and continue to move forward despite things not being as smooth as we would like? So it's not that the failure won't happen per se, but it's how we respond to the actual action or the way things happen. So with that, emphasizing that failure is not a bad thing, it's not a negative, it's actually a part of life, it's actually going to be a part of your growth. And a lot of times the biggest lessons that we're going to learn are going to come from those times where we feel that we absolutely failed, when that may not be the case. We've actually grown a lot more in the process. So kind of switching it from that negative connotation to more of a positive for them is, I think, key with that. Yeah.
I like that. You know Steve Curry? I don't know if you know him. He's a basketball player. He's really good. And the kids one day were watching his documentary, and he talked about how, I didn't know this. I don't think, how he almost, like, he was about to be benched because he kept missing his throws. But the coach didn't give up on him and let him keep playing. And then he for whatever, it's like his second win came and he started throwing threes. That was the beginning. But right before then, he had a series of failed, like he missed 2 pointers.
That's right.
I was stunned. I was like, man, this is a dude that's so celebrated. He actually wears on the
records for 3-point shooting now.
but people don't see that. And so I love how you say, you know, just normalizing it. Even those people you admire, if you really watch closely, they failed. They made before to get where they are. So normalize it. It's not unique to them. So
making it relatable to them. Absolutely.
I love it. I love it. Now let's talk about like incentivizing. Is it a good, you know, are there incentives that may be good to encourage motivation in teenagers? Do you think that's a good idea? How I don't know. Reward, I don't know. What do you think about incentivizing them to encourage motivation?
Incentives. It's a spectrum, right? It's a pendulum. It's not one that we want to swing too far to one way or the other.
Okay.
But in a way, yes, there may be an incentive, but can we attach a value to that as well? So I was trying to think of like an example. Let's say, for instance, we're cleaning up the house, you know, we're getting ready for a new year. So we're going to maybe donate some things, right?
Right.
We may, you know, ask our kid, can you drive? Can you take this to Goodwill or Salvation Army, something like that? I'll put gas money. I'll give you gas money. I'll put gas in your car, right?
Okay.
But it's not just that we're incentivizing them with gas money, because they may go somewhere else too.
Right.
But helping them to understand the value that you're actually helping someone that may be less fortunate than you as well. So there is an incentive to it, but can we attach some type of relative or relatable value?
Like that.
That's also important to them, so that they can realize that, yeah, at one point the incentive may go away, but they'll still hold that value close and dear to them, even long down the line and once they're adults and beyond.
Okay. That's a good one. The attachment to value. And that's a value that is not just monetary or self-seeking.
That's right.
I like that. It's beautiful. All right. So for a parent who's watching, it's like, okay, so are you saying now I gotta motivate? I gotta talk to my kids. Like, what about self-motivation? How do you strike the balance between saying, like, I'm not going to be there all the time to, you know, tell you what to do and get you doing right. So how do you strike the balance, is, you know, so that, you know, the teens can also take ownership of their own motivation? What would you say to that, Doc?
Yeah, absolutely. So teens are building their autonomy. They're becoming more self-reliant as they're going through these years already. And we want to encourage that for sure, and encourage them to take that additional responsibility as they move on and move through life. One of the things that I like, and I think you may have heard it too, SMART goals. So we can help them to set their goals. We can help them to set different things that they want to attain. But SMART goals, so they're specific, they're measurable, there's something that's achievable they can attain. Also that is relevant, relatable for them. And there's a time that's to it as well. So it kind of shows them a pathway, but it's up to them to take the initiative to actually get it done. So that's one way to kind of support them while not kind of enabling them at the same time.
Okay.
Yeah, and having that supportive environment for them, knowing that, yes, you have my support, but at the same time, we're not going to do it for you. Here's what we're expecting. Here's the agreement. And then as long as you uphold that, then we're good to go from that standpoint. But definitely allowing them the autonomy, but then helping them to realize the responsibility that comes with that autonomy as well.
I love that support and instruction. Wow.
Mm-hmm.
This is good. This is good. Now, my question before we wrap up, are there any resources or support networks that you encourage that are available for both parents and caregivers and mentors to those who are dealing with teens that they can tell are unmotivated? What would you say to that, Doc?
Yeah, so I was thinking about that. One that we may kind of sleep on or not think about as much is actually within the school system itself. So if they have guidance counselors that they feel that their teen can trust, that certainly could be an option that's oftentimes available to them within their own kind of environment. And some schools are actually tied into psychology or social work as well. So that definitely can provide options, not just for the teen, but for the family, for parents or caregivers as well. Another is your teen's doctor. Can they potentially refer them to, say, family therapy if they need, or some other type of therapy that may be appropriate that can help a teen that's really struggling with finding that motivation, or if there's anything underlying that's contributing to that. And then third, one of the books that I was thinking of, they have the adult version, but apparently have a teen version as well. And that's the 7 Habits of Highly Effective Teens.
Wow,
So,
I didn't know that.
well,
Beautiful.
yeah, I was surprised too. It's more so geared towards our teenagers, but it definitely can provide great insight for us as adults, as their parents, as their caregivers, on kind of what they're thinking and where they are as well. So that those are some easier, tangible resources that can be available.
Thank you. That's liquid
Welcome.
verbal gold. How you say? Yeah, what you're saying is gold, sis. That's what I'm trying to say. I love it.
I
I'm
love
definitely gonna have you come on again because these topics are very important. Empowering parents to be better motivators of their teenagers, broker that conversation to encourage your teenagers forward. Even though that season can be frustrating, as it was when in our time. So yeah.
Right.
But Doc, as we wrap up, people are wondering, man, I like this doctor. I wanted her to come talk to people in my group. I wanted to come empower parents to know these tricks and these tips on how to better have communication with their teenagers that they may be worried about or concerned about. Where can people find you, Doc?
Awesome. And Dr. O, thank you so much for the opportunity. Thank you for your time and having me here. I've loved it. Find me on all the places and spaces, Loretta Duggan, MD, whether it's IG, whether it's TikTok, whether it's YouTube, you can find me there. And then also on Facebook, Dr. Loretta Duggan. So looking forward to touching base and seeing everyone soon.
Awesome. And thank you all for watching live and in replay. I've put her information down on the bottom, the Facebook, the Instagram, the TikTok, the YouTube. We'll be doing this again. I'm going to connect with you to schedule the next one sometime in the new year.
Love it.
And as always, thank you all for watching live and in replay. Please share this with those who could find this useful. And as always, if you or anyone you know is looking for an awesome, thorough family physician in the Mansfield, Texas area, who have conversations like this to help you live long and well, I am she. Have a good one. Thank you so much, Doc. I appreciate you.
Bye. You're so welcome.
Bye.
Bye, everyone.